Hi, I'm Dr. Jeffery from Cosmetic and Laser, and we have our client today who's consented to a brief video, and I've got my very experienced cosmetic nurse injector with me, Taleah Cosgrove, and our patient today has had significant photo aging over the years, and she comes up from Melbourne, and over the last 10 years we've been trying to maintain the volume in her skin, and have done many treatments on her. She's up here for a brief period of time, and whilst we would like to go on to other treatments, we didn't have enough time today to do for instance a neogen plasma treatment or any other energy-based treatment. So we elected just to put in some little mono threads in here, and we've done we've created a sundial effect. We've strengthened the nasolabial area coming into the buccal area. And as you can see, there was no pain. Did you have any pain during that, Pam?
No, I actually fell asleep.
Taleah put some local in. She just used a cannula. And we can see that Taleah's feminine touch seems to be a lot more consistent than mine, but I think the outcome will still be good. So this treatment principally, how old are you now, Pam?
I was 79. 79.
So we'll get some photographs from her to see how she goes, and she'll be up here in a year's time. Taleah, do you want to just have a brief chat about the mono threads and where we use them for lip shreds and jaw snatch and body threads?
Yes, so we can apply these pretty much mostly everywhere on the face. You can do it in the forehead for fine lines and wrinkles as well, if you're finding that botulinum toxin treatments aren't working for you, or your anti-wrinkle injections, or you might need filler as well. It's a great option for there. You can do it around the eye area just for softening deep lines and wrinkles. The top lip as well for really deep sort of lip lines or rhytides around there as well. Very effective through this buccal hollowing and wastage area, as well as strengthening the preauricular area. We can also treat the neck area as well. Obviously we didn't have time to do that today with our lovely patient, but it's very effective for tightening the neck as well, just stimulating really good collagen elastin. Pretty much you can do it everywhere, even in the nose, but that's something that Dr. Jeffery offers here as well.
Yeah, décolletage as well, you know, if you find you're getting a bit of fine lines through there. So we find that we're using an increasing number of applications in combination treatments with our patients, and whether it's a cog thread with a filler, or whether it's patients that have had other energy-based devices and we want to reduce certain areas of skin laxity, particularly facelift patients. We find often they get this sort of laxity in the buccal area, so we use different techniques there. So otherwise they'd have to have revision face surgery. So relatively, well, as you said, painless procedure. And now simply all we're going to do, Taleah, do you want to start removing some of those threads?
Sure.
If you can just pass me. So we just give them a twirly-whirly, and we'd expect in the next 3 to 4 weeks that we'll see some enhancement in the skin. And she's had filler put in her cheek down in Melbourne, so we didn't want to do too much there. And you can see they come out very easily. There's no major issues. Sometimes a little bit of bleeding. And if a little thread comes out, it's not the end of the world. You just pull it out. There's many threads. Sometimes they do migrate. It's not really a problem. If you would like to speak to Taleah specifically, this is an area of her interest, is mono threads as well as fillers. I'm happy to see patients as well. I tend to do mainly complex thread lifting. But all of these services are available at our clinic, and if you'd like to have a chat to our cosmetic nurse injectors, Taleah and Sophie Hall, they'll be more than willing to help you on your journey and give you a good management plan. Thank you
very much.
You're welcome.